We're live. Hello, Lorenzo.
Hello.
How are you, man?
I'm all right. Yeah,
Fantastic. We made it finally, man.
we made it. Yeah, I'm surprised. I mean, it's the first time in a place like this, and
Yeah, you like it?
I like it. Yeah,
Fantastic.
it's
I'm
great.
glad you came here. First of all, let me start to say thank you so much for being here. It's a pleasure for you to be here. Thank you so much, really.
I mean, I have to say thank you to you because I don't feel like so important to be interviewed or talk about in the podcast and stuff like that. But it's cool. So it's an adventure. So
Let's rock it.
let's rock it. Yeah.
So, before starting to talk about your nursing experience, I would like to talk your past experience because apparently before you became a nurse, you used to do like different jobs. You used to be, you used to work on the army, and then you used to be a security guard and instructors. Can we just go through those experience you had, please? Yeah.
Yeah, to be fair, I mean, I've been through a lot of different things. Nursing for sure was not my plan. My dream was to be a soldier, to go into special forces, maybe after stay into security or thing like that. Unfortunately, career didn't go well as I wanted. So at the same time, when I was in the army, I always have an interest in first aid and emergency care, thing like that. Even when I was a Boy Scout, I mean, I was a little Boy Scout jumping around with my little shorts and stuff like that. So I was already like that. And then when I was in the army, I realized, we didn't know nothing about first aid. They don't teach us nothing about that. It's very life-saving stuff. And it was like a period also that internationally things that were changing. Like even in the American army, they were talking about first aid. They're talking about more about what is called tactical combat anxiety care. So they created that. And so when I left the army, I was already close to the Red Cross in Italy, so I was just doing already some courses. So when I left the army, I was still volunteering in the ambulances, and then I've been an instructor, yes, because I was in the ambulance. Then I met some people, and I started working with this company. It was an international company. I was working on oil and gas, and I was teaching people first aid. I was teaching trauma, basic life support for people that they work on the oil and gas rigs and platform offshore and onshore. So and then at some point they say I want to be sort of like a paramedic or thing like that. We don't have that in Italy. So I went into nursing, trying to do that again, do nursing on the ambulance. Then at the end, I got stuck in an hospital. And I'm still fighting and thinking about going to go back, maybe try to find the kind of job I wanted at the beginning.
Right.
Yeah,
a lot of experience.
Yeah, a lot of different things. Yeah, never stop.
Going on, yeah.
Yeah, always something going on. Always, yeah. My brain is always a mess.
Me too, man. What I'm interesting is about your tactical medicine experiences. How did you get into that? Where did you get the course? And you literally you've been in Texas.
Yeah.
To teach people how to do that.
Yeah.
And I want to know a little bit about the experience and what does it mean to be a tactical medicine instructor.
Yeah. So practically, my idea was I want to be able to teach this program. It's called Tactical Combat Anxiety Care to the soldiers in Italy. I wanted to make a difference and be able to save the lives of other soldiers through the training, because the basic of these, there is the body aid, so helping each other. So you are in team with me, something happened to me or something happened to you, and I rescue you. I do something on you to make the difference in the first minutes that it can save your life. So to get into that, of course, I didn't have so much experience in the army. They didn't have there was not even a combat medic professional figure in Italy. It never been happening. So now there is something called soccorritore militare, and it's similar. So I was looking already to America. I always look at America. I grew up with a American flag in my room, so I've always been with the American dream in my head. There's always a bit an issue with me. And so in America, these things happen already for years. And I was looking for courses. I knew of this course in Texas, Cypress Creek EMS. And unfortunately, now is closed. It was a great organization pushing real good medicine, and they were running this course called a Basic Tactical Operation Medical Support course. Now it's
Wow.
called BTOMS, and now they started again. Some guys they restart again. So I say that's the moment, I got some money, just no time to wait, and let's just go there and learn from them, get like a sort of full immersion, and when I went there for 1 week, learned a lot of stuff. Told them that I wanted to teach in the future. I was already a background of an instructor background,
Yeah.
so they told me, "Yeah, we're gonna help you," and that's one of the thing. Like White Texas and these people, they are still in my heart
So
because they
you're
are
wearing
people.
you're wearing
Yeah, I ended up for yeah, I didn't have it, but this is like a flag. It like this is Texas, and it's like in the back is written "Never Quit." Is like a seal that did this series of T-shirt, and it means always like never give up, never quit. But the mentality that I met there, the people that I met there, they're still in my heart, and they're people that they made a difference in my life. Also because then I came back, I've been able to teach, I've been able to bring Stop the Bleed classes for free to the population, police officer and other people, and probably I made more difference with that than with the tactical combat because I take care. Then it's more difficult to put in place. Well, yeah, a lot of stuff.
So as an instructor, do you teach like different like people with different background, or is like specific people who come in your classes?
So my idea was at the beginning just to work with the military. So military security people, security professional, and then for it was like something happened like that. There was this program is called Stop the Bleed. Is always part of the Department of Defense, and is always promoted by them. Is like their trademark and been supported by the National Association of Emergency Medical Technicians, American College of Surgeons, and a friend of mine asking me to teach the first class. As calling Michelon is a good guy, and so we say let's go. I mean, it's a free of charge course,
Yeah.
2 hours, and you can teach to everybody, and you can make a difference because you teach people a bystander, something happened, how to stop the bleed, how to make a difference, and like save a life. So I can teach that to everybody,
That sounds
and I
exciting.
teach. Yeah.
Like when you got the course to become an instructor, you literally had to go through like just the teaching training, or you literally need to go on the field to have a proper feeling of what's to be to deal with a military situation. Never happened for you. You never had that type of experience.
So that's one of the thing. So I don't have a real combat experience. I cannot lie with that about that. My CV is on LinkedIn. Everybody knows that. Some people feel like I'm a superhero, thing like that. I'm not at all. I'm just like a professional that learns some stuff from other professionals, and I just teach that. Of course, bringing my experience, my ability to take care of patients anyway. But of course, I miss maybe the combat experience. But there are not so many people that I can teach their experience in the war. There are not so many people that have been in a real combat situation and they treat a real patient in a combat situation. So there is a very, very limited number of people like that. Might be more from America, maybe UK, not so many from Italy. And not so many can talk about that, maybe because they're particular regiment or professional. So simply my experience is just like I developed as an instructor, I developed as a medical professional. I mean, like healthcare professional in my case. I mean, as a nurse, and then I started teaching something that was like internationally accepted. So nothing extremely new.
Nice.
Mm.
So now we're going to move to your university experience. So you literally then decide to become a nurse. How was that to become a nurse, going through all the nursing training, university? What class did you find easier? What class did you find more difficult?
Mm.
How was your university experience?
I'm over in
Was it like
university.
American Pie style?
So the thing that I started my experience quite late. So I was nearly 30 years old.
Okay.
So I failed already university in economy. I was studying business, and now business and economy. I don't know how to say we call it economia in Italy. And so I was not a great student. I was a very bad student. So then I went in the army. Then I tried again to finish the study. Then while I was in this company and I was working in teaching and as I said before, I wanted to be a paramedic, but there was no paramedic in Italy, and the problem never happened to have this kind of professional figure. So I decided to go into nursing. I tried the test because you have to do a test to go into the
Entry test,
university,
isn't it?
entry test, exactly. So I passed that, I was one of the last ones. So very the minimum, and then I say, all right, this is probably destiny. Probably I have to do this. And my family, I have to thank my mom, my dad, because they support me after I failed with the uni before and I wasted a lot of money. They say to me, all right, okay. My mom still thinks I should have done medicine, but they say, oh, well, let's go. Okay, so I just got concentrating on that. I just studied as much as I could, and I was like a bit American Pie sometimes. No, I had some fun. To be fair, I think in the university before I didn't really enjoy so much. So I took the moment when I say now I have to enjoy. There is a party. It's time for partying. I enjoy, and now there are moments when I have to study and just study. And I was very disciplined. Something that I would like to be again now, but I'm not disciplined anymore. But yeah, I've been very disciplined. So when I had to study, I study, and I really find it was very useful to study in group, help each other. I was at a team of friends. We were called Acapulco because we were sometimes singing this song. It was called
Was a mariachi song?
Exactly. No, it's it's an
Yeah,
old
I
song.
know
It's
that.
like Acapulco is this Italian song. I don't remember. Ricchi Poveri, I think is. Anyway, we were teaching that. We were singing just to relax sometimes because we were too stressed. And then I've been able to get through that. But when I was already in the uni, it was difficult. Yeah, some studies were difficult. Anatomy, physiology, pathology, they were quite difficult stuff. Not all the teachers and I don't know how to say that they were so friendly.
Yeah.
So I find sometimes the mentality even in nursing can be a little bit obsolete, and it should be a little bit more modernized. But I managed to went through that, and I'm very glad that. And yeah, and I am, and then I keep studying because it's a never-ending
Yeah, I
Story.
can
I
imagine.
just finished to do another course at the university for critical care, but I think it's been a good experience, even if it's been tough.
And then we move it to your first nursing job.
Mm.
Where did you get the job? What type of work was it? Was it still in Milan? Because you went to university in Milan, if I'm not mistaken, right?
I was in Pavia.
Pavia,
So
okay.
Pavia, yes. So it's practically a suburb of Milan because it's so close now. But yeah, it's a nice little city. I mean, quite big province, but the city center is not so big. And I studied there. And then I was saying, I mean, in the university, I was already like pushing myself and thinking about I need to learn English better. I was teaching already in English before going to uni, and
Okay.
and I had experience like in Oxford, in Finland, as a
Oh, you've been
student.
around quite a
Yeah, I've
bit,
been
yeah.
around, so I was already in that position to say I have to do things internationally. And so my first job was just like a job for the summer. I was just covering, the summer holidays in a hospital, private
It's kind of
hospital.
part-time bank
Yeah, it was
shift.
just like a short
Okay.
contract. At the same time, it was like a big moment for people immigrating to UK, for nurses. They were coming to recruit you in Italy from different hospitals. So I had a couple of interviews in Milan. My English was not so bad because I was already speaking English for a while. I started English. My mom sent me when I was like very young to study English in the elementary school. And so I was not so bad. I did interview and I wanted to go for emergency department. So was difficult in Italy. I told them, if you give me a job, I can to your country. If not, I'm just gonna stay here. I can find a job that I don't like, but I cannot find the A&E. I mean, no emergency department that I want to, that what I wanted. So
Yeah,
they,
as we know,
yeah. So I
economic
push in that direction.
situation, healthcare system is not that good, and in Italy,
Oh yeah, I mean,
it's
it was
also an
not a
open
great time. I
position.
mean, it's like now there are more opportunities because
They're all living,
there are
eh?
no nurses. They're all leaving, or they're all burn out in the living. Me too, sometimes. And but it was very difficult to get into the position, and I wanted. It's still difficult now. I mean, I wanted to get experience in the emergency department, to get back to the ambulances, and get a couple of years in my region. They want a couple of years of experience in emergency or in critical care before you can go back on the ambulance as a professional. Then I wanted that experience. Then I came to UK and I got stuck here.
So now we move to the exciting part. So you got a job in an emergency department in one of the hospital in London. Um, tell your like your daily routine on a emergency department. It can be like kind of challenging sometimes.
Survive.
You did, man.
So must of all survive. You know, I mean, I started in Croydon, was very busy, and I was a whole department. Then they built up a new one after I left, and they were already doing some big development, and was a very very busy one. And I was finding myself at the beginning. I came as an healthcare assistant, so I needed to learn a little bit. And this, and it was my first experience. I was really
NHS system, yeah.
new. I mean, I was really new even in the profession. I mean, and it was crazy what I did if I think about it. So I started for like 1 month as a healthcare assistant. Then I went into nursing and worked as a nurse. So they used me a lot at the beginning in the observation ward and things like that. And then I gained experience. Then I had some more experience in the other areas of the department. Then I decided to leave because I always had this big issue. I always wanted to be a trauma nurse. I mean, specialize in trauma, always connected to the military aspect. Um, so yeah, I went to St. George's Hospital. It was a trauma center, and then started to get more experience and more exposure to different kind of patient, different kind of situations, and I've been through pediatrics, adult triage, resuscitation room, and that's I think that's been the big step for me, definitely.
I want to still stuck with some A&E experiences. I'm sure you had a lot of patients coming in with overdose, stuff like that. What would you do to stop an overdose? Well, literally, if a patient coming in with an overdose, what would you do?
It depends. The thing's always like you don't know what they taking. So and nowadays is really understanding is be like an investigator. I find myself really as an investigator looking into the pockets of people, just like even because they maybe lost their consciousness, and you have to understand what's going on. Try to find like blister of medication, try to find blister of anything, or like any trace of the medication or what else they've taken, or just to be able to do something, or like get information from the friends, family, or what drugs he use, what does he usually, or things like that. Because you can never know. Sometimes it's the medication, sometimes it's alcohol, sometimes it's a mix of everything, sometimes it's a mix of drugs. When we talk about like spices now, you don't know what is inside it. Like they smoke this stuff and they put in this stuff anything, and just to get high, and at some point you really just treat the symptoms. You just really try to fix them, try to treat the symptoms just to be sure they're not gonna die with you. And you and the doctor, of course, as a team, we work together. We try to just to treat them and be sure that they survive. And if you understand what's going on, if what they've taken, I mean, there are things like ToxBase. There's like a website that we have access to, and you can go through big lists of like what they've taken, and they tell you what to do. Like example, even like I use the chemical product they and ingested like the hole for the battery. I don't know. I mean, the hole for the battery probably is gonna have big burns, but anyway, something else, and they tell you what to do.
Yeah,
and that's very helpful.
big
That's kind
help.
of, yeah. There are a lot of things, a lot of protocols and things that can help you in your job nowadays, and this is one of the example. Talkspace with the kids example. A lot of time they ingest thing that you never imagine. You know, like there was a time you remember when they were ingesting. This is not just like an overdose example, but they were just doing the stupid things with the pods of the washing machine. You know, the pods with the washing machine. They
Yeah.
were just doing them. They were putting them out and they're breaking like teenager. They were doing this stupid thing, and then this was going out. I was just thinking about the washing machine because I need to buy some stuff when I go back home. But these kind of things can give you burns at the beginning you don't see and then develop in a second moment just because of the I think
Yeah.
it's alkaline or thing like that inside
Chemical,
of the
yes.
chemical and how you treat is is more complicated. You need to do different things and you need to know what they ingest most of all to treat these kind of things.
As you say, you need to kind of be an investigator too.
Yeah, I found myself really in having a look into the pockets. You have to do that. And I think you're legally covered about that because you're trying to save the life of someone. Sometimes you have patient that don't have like you don't know what's their name, you don't know where they're from, and you have to like to find like maybe I'll find myself in looking for the emergency contact on the phone or try to call someone like to tell oh your relative is here or they were calling me on their phone. Calling them on their phone, and I was just hanging and say hello. My name is Lorenzo. I'm on the nursing emergency department, and your friend who is he? And then maybe boom, falling from the sky, and sending maybe the relatives to the hospital, and that's it can be a horrible experience. I mean, for me as for them, for sure.
Right. Now I want to ask you. Some waiting. The queuing time in A&E. It can be. It can
So
be seen as a
tricky.
problem. Yeah.
Yeah, thanks God I'm not working there anymore. Um,
I want to ask you, if you would be the king of the world, what would you do to stop long waiting time in A&E?
that's a big question. I don't have a real answer to these. I mean, I think I think it's always the same issue that they keep going and getting worse and worse and worse. It's like a mix of things that you can do. It's like education of the purple or the people and in teaching them what is a real emergency, why they don't need to come to any, why they need to go to some other professional. But there is always a problem of resources anyway, and even if the people they know that they have to go to the GP and they don't find a GP appointment and they have a issue and don't have any friends that is a medical professional, healthcare professional to ask,
Yeah.
at the end they're gonna end it up in A&E anyway because they have a issue, they have a problem, and they want to solve it. And if they cannot solve it in another way, and they just come to you.
To
So
A&E,
it's
yeah.
just a problem of resources, and resources they gonna keep going, more scarce, less and less in the future
As we
anyway.
know, yeah.
It's not something that we're gonna fix easily.
So what's the main? Because I've seen a lot of nurses like complain because people end up in A&E for just literally stupid things sometime. And what's the main cause why people end up in A&E? Was something very common people end up in A&E? What's the most common cause?
Uh, it's I mean, to be fair, I saw one of the most common. There were like things like chest pain or like abdominal pain, things like that. Things that maybe they can be treated with some basic medication, like with just some painkillers, sometimes just some rest, just some eating properly, or maybe not get drunk the day before,
Yeah.
and just a basic thing of education that I should probably um, learn somewhere. I mean, I don't know, school, their parents, relatives, or thing like that. I think a lot of times you get upset because they come to you for these, and you are. I mean, you didn't chop off your arm, so it's not an emergency for me. Why are
So
you here? But at the same time, for people, you need to understand. For maybe for them, it's an emergency because they don't know how to treat that. Can be frustrating for them because they cannot keep going with their lives. So to be empathic is very difficult, and to maintain the along the time along of your career professional it's very difficult. I find some patients sometimes they say, "Oh, all right, why is he here again?" Oh, I mean, and then the patient was showing me that they were like struggling for that, and then I was realizing this is important for them. So I need just to be empathic with them, try to help them, but it's not always so easy.
So people make sure you call on one before end up in A&E.
Yeah, I mean,
Just
yeah,
to make,
one on
if you
one. I
don't want to
mean,
put
learning. I
pressure on
mean,
A&E.
sometimes it's just about learning things. It's just about we. I mean, I don't advocate for sure going on Google and say you have the pain, and then they come out that you have a heart attack because
Some people,
Doctor Google is not good, but let's
but
just
it
like
helps.
but yeah, it can help. I mean, it's just a little bit of education. But sometimes I have patient coming to me. I had patient coming to me and tell me, all right, I got this pain, I cannot fix it, I cannot find an appointment with the doctor, I tried to take painkillers regularly, but it doesn't
So
make any difference. I say, all right, you try your best, and then you come to me. That makes sense. But when they come and with me, oh, I got this pain, they say, okay, have you taken some paracetamol? No. Have you taken some ibuprofen? No.
no,
And they say, I mean, at least try.
at
They're not
least.
gonna give you the same medication. It's a little bit, it's a little bit ridiculous. And then they get fix them and they say, okay, no, I'm all right. I just need a little bit. Okay, see ya.
See you.
But that's an unnecessary,
Yeah.
coming to A&E. But it's not easy. I think it's a big issue.
So now you currently work in one of the biggest teaching hospital in London in the United Kingdom, and
Wow,
as a
didn't
senior
know that.
nurse in a cardiac intensive care unit.
I'm not properly a senior, but yeah, a senior's experience, but no, as not as a role and pay. But that's it. We're working on that.
So I've seen I've been sharing some shift with you. I've noticed you're very meticulous the way you deliver your job and very
Thank you.
professional. Just please explain your daily routine in an intensive care unit department and explain your
It's
setting
has
there.
been a big change for me.
Yeah, from
Um,
A&E, sorry,
yeah,
from A&E to ICU
yeah,
because it's also you need to have different state of mind as a nurse.
yeah.
Because I find it A&E nurse compared with ICU nurse is more like the ICU nurse is more focused on the background of the patient, everything organized. You may have a contact with families and stuff. Compared with A&E one is you jumping from a thing to another. You just multitask. You do everything. You don't want to know about the patient background. You don't really want to just meet the family. You just want to make them safe and jump to the next patient.
Yeah. I mean, it's chaos is for sure. It's
Yeah,
something that happened in A&E. You try to fix that. You try to put some order in there. Not always possible to do that. You jump from one case to the other, and sometimes can be very even demanding because you jump from one cardiac arrest to someone that is complaining for a pain and he has got like for 18 months, and you say okay, and that's their priority at the moment, but maybe you just seen something that is touching you or like changing your mind, and you go into intensive care is more organized environment that can be chaotic too, um, and um, and you go on more a routine anyway, because you don't have coming in and out so regularly.
you mostly allocate
Yeah,
only
maybe
one
yeah,
patient,
you go
isn't it?
1 to 1. Usually it can be 1 to 2, depends if the patient are
Depend,
less
yeah.
sick.
Funding
If the
and
patient is sick, or so depends also on how many nurses we have because that's
yeah.
a issue even there. And but usually it's 1 to 1. But usually if you have a patient and you stay there for a long time, you just usually start in the morning. You come, you get an handover from your colleague at the bedside, and you understand the patient if you didn't meet the patient before. Try to learn as many things that you can in handover, and then you go through your checks, safety check, assessment of the patient, and it's more meticulous there compared to A&E. Maybe you got more time. If the patient is stable, you can do your things and get everything ready. And of course, you go your timing for the medication, timing for the round of the doctors, and discussion of the case. Sometimes it's better with A&E because you have the knowledge of what's going on in the patient before of what happened with his past medical history or things like that. And you start developing a plan. What we're gonna do today? We're gonna do this, and this. and you try to stay in the timing, also to have your breaks and things like that between your colleagues. It's totally different job, but but the experience that I brought from A&E, I still like this experience to stay with me. I still define myself an A&E nurse, and with like trying to be a critical nurse, trying to be on time, trying to respect the organization, and I became more meticulous on some aspect, more precise, more clean, because I go maybe a little bit more time. I want things to be under control, but sometimes you can't even there because it's mess. Even there can be.
So I remember we just passed COVID time, pandemics, and I remember during the pandemic and the cardiac intensive care unit was completely turned into normal intensive care unit into a fully COVID. How did you find that? Like, did you find more pressure on you, or was simply just business as usual?
This was one of the most difficult moment of my life. So I got goosebumps now, pelle d'oca, yeah, in Italian. So I left A&E. I was pretty burnt out. I mean, I didn't get the promotion and I wanted. I was very upset. I was very nervous, and people they noticed also, friends they noticed I was quite built up in a sort of aggressivity and thing like that because I wasn't happy. And I say, let's go to intensive care. Let's go to a places like I can learn something new. I did practically everything I could in A&E, apart of like developing in some senior position. And so intensive care was looking as an environment where I could have developed some new skills, and I would have been a little bit more quiet. I mean, that's a fault. And practically I started at the beginning of February, and I didn't even finish my introduction, like it was the basic course that was helping us to start the job there. And around, I think the 20th of February, thing like that, we were already switching to full COVID ward. And I was not prepared. I didn't know nothing about the job. I mean, apart of like my A&E experience, I didn't know so much about ventilation. Patients that were very sick on a lot of medication. I didn't know how they were really working. And I was already in burnout, and I was really, really stressed. I don't know how to get through that. But they helped me just keeping me on one-to-one patients, so they didn't give me more than one patient because they knew that I was new. And that I think helped me, and I learned a lot. The first wave was not so bad. That I had sort of like I was still worried about dying. That's when I was thinking. I was right. I was in my already nearly in my 40. Yeah, I mean I was already in my 40, and I was some of my patients in my bed. They were 40 years old, and I'm like. And I was worried, like, I'm going to pick it up.
Than that, isn't it?
Yeah, no, I mean, I was around 40 already, yeah, and they were around 42.
No, I mean patient, like.
Patient, yeah, they were even younger, yeah, I was even like 36, I had a patient dying even at 26 or something like that.
Yeah.
And I was young anyway, and I say, oh, maybe I'm going to catch it up, the COVID, and I'm going to be the one in that bed. And I still remember one of my friend, she's Spanish, she's Maria, she's lovely, and she touched me once. She touched me on the shoulder where I was at work. And I jumped away from there, and she say, "Oh, I'm sorry," because I was so scared about human contact, and I was worried about catching the virus and get sick as my patient. And at the same time, my family was in Bergamo. Bergamo was being badly affected by COVID. I was feeling the guilt not to be there. I'm looking after my family, looking after my mom and dad. They're under 70s and 80s. Not able to look after my country, my city where I grew up. It was pretty horrible psychologically, physically. Also was very demanding. I was sleeping and working and sleeping. That's it. That was the only thing.
Yeah, everything was closed.
Everything was closed. I still remember this feeling like going to the shop. There was the queue for shopping food. Maybe I was a very bad person. I was jumping the queue because I was telling I was a nurse. Yeah,
so all right, you come first.
And they would tell me, "Oh, you can come first." Okay.
Actually, some of the supermarkets will allow NHS staff to go.
Yeah, no, they were doing that. They were doing that.
I remember.
At the beginning, I was feeling bad, but at some point, I say, "All right, I'm gonna use that."
We're the only one working right
because
now.
I cannot. Yeah, I cannot stay ages in the queue. I need some food. I need to work. And so at some point, I was using this thing. I was showing my badge, and I was jumping the queue. And to be said, I was thankful to the staff in the shops.
That was a
I,
lot of
I've
regard for NHS
yeah,
staff. I
I
remember.
think there's something I really appreciated. And the first way we were looked after as like heroes and stuff like that. Then probably even in Italy in the second wave they forgot about us. But I like that. And I enjoy. I mean, I took the advantage when I could because it was helped me. And I found myself in thanking the staff at the shops like. Thank you to be here. Thank you to do your job now and selling me food because I need this food to go to work and
Yeah.
and keep doing my job. So it was the most demanding moment of my life, and
Yeah.
I think a great experience at the end. But only now I understand that. But I'm still struggling sometimes.
So obviously in ICU there is a lot of equipment and an equipment that amazed me was the blood filter machine.
Mm.
You know, can you explain us how the blood filter machine works? Because
Yeah, I mean, there are a lot of machines that we have to run. Sometimes I feel like more a technician than a nurse, but it's part of my job. Filter machines fundamentally is a filter. You know, it's just working as a kidney. It's just doing the job of filtering the blood through different process and practically do the job of the kidney, be able to get all the what do you say, the waste products away from the patient and put in some bags of fluids and give some other fluids and electrolytes and stuff like that. So it's a demanding process also because you have to run this machine continuously.
yeah,
So you need to learn how to use it. During the first wave, we had some old machines, and I didn't know how to use them. I mean, no one
yeah,
told me. I still remember myself in this room. There was my colleague with a very busy patient in the other room. There was a side room. And I was in the other one. I said, they told me just the basic stuff, and I was trying to fix the things and things to get the machine running. It was like
all the
feeling
tubes
like
going on
yeah, things
and
beeping is not working. The access to the patient was not good, and the machine was very complicated, quite old
because
school.
apparently
I was
one tube is attached to the main artery.
so
There's
yes, it goes. It doesn't go. It doesn't go in the heart. It goes in like a main vein.
okay,
And we got a big catheter that goes inside. A big vessel can be in the neck, can be in the groin.
in the groin.
And you got two lines, and one is in and one is out
One is out.
fundamentally. So and you have to be able to. So the machine has to be able to suck from one and give back to the other one.
Yeah, I want to ask you which one is one of the greatest equipment you ever worked with within your healthcare
What do you
experience?
mean? Sorry, greatest.
Like equipment, like all this machine. There's a lot of
In terms of like the more complicated or
yeah. Which one
or
you
the I
like?
prefer. Um, I'm I came to intensive care master for the ventilation. Um, I wasn't really excited about the filters and stuff like that. They told me about them, and I said, "Oh, okay, looks like a pain," and it is. Unless you know how to run it, unless the things they run well. But ventilator, they're very interesting things, and it's something they still try to learn about. Still, like I know that I finished my courses now, but I need to study more because sometimes like in the COVID era, I mean, the patient
There's a lot of ventilator going on.
they were not ventilating at all. It was horrible. I mean, RDS is like acute respiratory stress syndrome. So and they literally they get wet and they cannot ventilate. So we were trying to do our best to get the ventilation working and like things like proning the patient, and or using ventilator setting, different ventilator setting. And sometimes I still need to study things and try to relearn things that I forgot after the course
Keep up
because
with it.
it's a complicated stuff and there is still a lot of learning,
Literally, the
a lot of
ventilator
studies going on.
machine is just to give more oxygen to
Yeah,
patient.
it's not. It's about a lot of things. It's about giving oxygen to patient through a tube or a trachea, and it's about um, offer the volume to the patient, so a specific volume. is about giving support to the patient, ventilation when it needs, and how we need that. If the patient is totally sedated or not, if he breathes on his own, so initiate the ventilation, and the machine give them oxygen and volume. Or if the patient is totally sedated, and you have to do everything for him.
Yeah, because usually you can provide oxygen to patient with a normal cannula, isn't it? Normal nose cannula.
Yeah, if you're
And
breathing on
why
your own,
you
yeah.
don't use normal cannula and you use a ventilator?
I
What's the
mean,
main reason? You
sometimes
need more oxygen?
sometimes it's not just about oxygen. It's just about volume, the ability of the lungs to expand,
Okay.
and the alveoli to do their job and have like a possibility to exchange the oxygen between within the alveoli and the vessels and the blood. So so sometimes the patient, even there are a lot of different, so the patient ventilate on himself, can use like a nasal cannula, can use a mask, or if this is not enough, you need to give some pressure, so you need to keep the alveoli open and give the possibility to work and exchange oxygen. So
Okay.
you can use non-invasive ventilation. So you got this mask that they seal on the patient, and they're horrible. And the patient, when they take a breath, the machine gives them pressure, and then when they exhale, they have less pressure. Or and when these fail too, at some point you have to overcome all their breathing.
So now just jumping back to the COVID talk, and I want to ask you, most of the patients who end up in an ICU with COVID, did they have vaccine previously done, or most of the patients you had they had no vaccine done?
Oh, that's a big question. I mean, in the first wave, of course, we didn't have any vaccine. So I think there was much more. Was a lot. I mean, there was a lot of patients we had with different ages and things like that, different pathology in previous pathology, things like that. In the waves after, we started notice that a lot of the patient that we had, there were patients that they didn't have a vaccine. So, and I still remember that because it's like we were starting the shift, and over with the patient, and we would say vaccinated or unvaccinated. It was like a little bit weird, and it was like, oh yeah, this is non-vaccinated, this is non-vaccinated. So, and that was like one of the main reason why they were there. Some people they were vaccinated too, and unfortunately they were there anyway because they were fragile. The most of them that were showing to the critical one that were showing to not to be vaccinated. Yeah.
Because I remember these, like most of the patients I used to see were not vaccinated. So I remember that.
Yeah.
So now we're gonna talk about the medication, the drugs used, like fentanyls and morphine and propofol. What's the difference between like
Very specific
fentanyl?
one. I don't know.
Because
Yeah, should I study
fentanyl
more?
and morphine are both like it's kind of similar drugs.
Yeah, they're kind of similar drugs.
Is
How
an
they
opioid,
is an
but
opioid is how they are product.
fentanyl
Yeah.
is chemical opioid.
Yeah.
It's not from natural.
Yeah, it's
plants,
more.
isn't
It's
it?
like more chemical. Yeah, yeah. It's more. It's more the production. It's more synthetic, and they work a little bit in a different way.
When you use fentanyl, when you use morphine,
To be fair, we don't use. Depends. So fentanyl we don't use that so much in my unit. We tend to use alfentanyl. That, to be fair, I don't remember exactly the difference between alfentanyl and fentanyl. They did. I think the time in the body they don't last so long. In example, in neuro, they tend to use the fentanyl. Morphine. The advantages of fentanyl usually is more for sedation and pain relief. Morphine used more for pain relief. Pain relief things. So it's never using like in continuous infusion. Fentanyl, you use them in a you can use them in a continuous infusion. You can use them also in moment like intubation. Morphine is usually predominant as a painkiller. A lot of users still in emergency department. A lot used in still in pro hospital. With pros and cons, these like influence a lot, like the blood pressure. Most of all, if you're a traumatic patient, it's still very discussed the use of morphine on a trauma patient with like blood loss. You don't they just abandon it in the most of the military example. In the past, they were living like still like in pen to inject morphine, and has been abandoned practically by the most of the army internationally. I mean, I'm not for sure the Americans, and even I think the British too.
Can
Um,
those drugs here been self-administered, and can a patient become addicted with these drugs?
Addiction is not so easy to develop as we think. Um, we offshore there is some sort of addiction. You need to get them not use it to the medication for too long. But of course, every time when you stop a medication like that, and they've been for a long time on this kind of medication, it can give them a little bit of trouble in getting rid of that. But it's not like an addiction. Like when you were talking about addiction, like example in America, they're talking about a lot of the addiction of painkillers, addiction to this kind of morphine, opioids, and that they get used by the doctors that they prescribe them, and that they can keep taking, and then there's the mental addiction because they're taking on themselves. It's not the same thing, but yeah, it can give an addiction, but
Yeah.
it's not so easy in our environment. I think we don't notice this problem. We notice maybe that the patient needs to go if it's been for a long time. This kind of medication maybe need to continue a little bit, and
Like a
then
going
slightly,
progression
yeah,
down a
yeah,
little bit. Yeah.
everything needs to go slowly down, um, because they still need that, or because they are in pain anyway. So, one of the funny thing I noticed is example. I was giving a morphine in any like water when they were like really in pain, and that was not affecting at all their blood pressure
Yeah.
because they were in a lot of pain, and they were helping a little bit, so they were not suffering. They were suffering less, but they were not having issue like one of the problem with morphine is the and the whole fentanyl and thing like that is the your breathing ratio can go down and stop, but when they are in
Oh,
such
they
a
can.
way, then the risk is not the same. But you have to be careful and give the small dosage and see react. I had a bad experience when I gave too much to a patient, and I was elderly and nearly stopped breathing, and I had to give naloxone and reverse the effect of the morphine that I gave, and it was not a very nice experience. I still remember that. Quite shocking, but yeah, you got naloxone that you can balance in case stream. But it's been only one case in all my career.
And then the propofol is also called the milk of amnesia. It's different because
Yeah,
like
propofol give you sedation and can influence blood pressure too, and can give you hallucination on a long time, sort of sleeping but not totally sleeping as a sedation. So a lot of times we think like people they are sleeping but they are not really sleeping. It's like a sedation. It's like they keep them calm, they keep them like their brain activity is still there,
yeah.
and you can see the patient even like when you like keeping doing noise around them, light, even if they are sedated, you can see that difference. Or if they are in pain, you can see the difference in their blood pressure. You can see the difference in their heart rate. So you learn these things with the experience, and they can sleep even when they are sedated. So they can see all the parameters of the observation that goes down because they are sleeping, even if they are
Yeah.
sedated or they are
Also,
more awake.
another drugs I would like to talk is adrenaline.
Mm.
Like when do you use adrenaline? And what's this literally adrenaline? What's kind of
Oh my gosh, I should have prepared more. So adrenaline. So adrenaline works for sure in the contractility of your heart and in also of your vessels. There are different dosage that can be used um, for sustaining heart and their contractility, and or in different doses it can be used even for allergic reaction,
okay.
thing like that. So it's all about depends what you are doing. What's why you're using a medication. and that's for any medication you are
Yes,
you
that's
are
in the
using.
moment.
Why you're using the medication? There are pros and cons for any medications, and there are different doses. Why you're using the dosage for what you're trying to achieve, what kind of patient you have, what's the reason. Yeah.
So now, jump to the next question. Is like, is underfunded or understaffed NHS has ever limited or impact you in deliver your job?
So, so yes, so it's no. I think we are on some aspect we compare it to other experience I had in my life, like even working in Italy. We have a lot of resources. We have a lot of money. Um, Maybe we have a lot of money, but we don't have something that is very important. That they are human beings.
Yeah, you
So
notice those
yeah,
differences.
it's still a resource. Yeah, it's a human resource. So if I think about what I do in my job or what I've done in my job in NHS, I think it's been a great experience. I used some of the best equipment ever. When I am in intensive care, I got great equipment, great machines. Just thinking about the filters, the example, a new filter that we're starting to have is very advanced, computerized, and it works very better than the one we had before. I like it, and it's an incredible machine. It costs a lot, and sometimes we struggle a little bit with some equipment. Maybe we don't have all of them, but then they arrive. So we are pretty doing good. The problem is that you can have the money, you can have the equipment, but you cannot replace easily a human being. There is I don't remember specifically the motto, but it's about the special forces in America. I'm missed to be a special force. That's what I really wanted to be, and I not failed, but I couldn't even try. And they say at the end the most important thing is the human being. Okay, so you can give them all the equipment that you want,
All the
you can give
funding,
them the
everything,
all
but
the cool gadget, the helicopter, the flight, anything. You can give the best ventilator and everything. But at the point you don't have at the end a human being with all the quality, ability, and you're investing on them, you're not gonna be able to make the difference.
yeah, I
Yeah,
totally agree with that.
yeah,
Especially in the type of job you and I'm doing, that's one of the most important skills, isn't it?
yeah. It's developing their skills. It's having someone that is value and give them value and give them the chance to develop. And sometimes I'm always complaining. I'm very talented, and that's very different. I'll ask, but
Yeah,
they always complain. Sometimes I say I'm very lucky because they invested in me. They give me opportunity to develop. They give me opportunity to do other things, and it doesn't happen so many places that you can do these kind of things. You can go back to university and pay the support to do the studies, and develop new skills, and be a different type of nurse compared to what I was before. And so I think this NHS is great. I mean, in this kind of stuff. And but unfortunately, you always need to people they retire, they get tired. People like me, they get burnout, and they want to keep quit and think about doing another job. And but if you retain them and you create new people like me, you can keep the machine running. But it's not so easy.
so jumping to the next question, I want to ask you, do you think you get paid fairly?
I should have read the question before we did the interview. Yeah. I think there is no limit in the money that you always want.
Yeah, we all agree with that,
Yeah,
right?
we always want more. We always want more, and a thing like that. I think like sometimes it's not enough, because the ability to have a quality of life in line with your responsibility and the effort that you put in the study and the work is not balancing that. So I feel myself, like example in London, it's the quality of life. It can be very low because it's very expensive. at my age, because I failed, maybe sometimes also my fault. I couldn't get developed in a senior position, couldn't get better pay. It's for me practically impossible to own to buy a house or even rent a house on my own. So I've like 43, sometimes like sharing the toilet with some friends for the people that I don't really know is a little bit demoralizing. And I say, why I'm here? And I say, maybe in another country will be able, maybe even in Italy, I will be able to rent a house.
Yeah.
I was struggling maybe too because the pay is very low, but maybe I will still manage to have my sort of like little place.
And if you would have an opportunity to talk to the prime minister right now and to give him a number, what do you think? How much you should get paid, like to meet your
No comment.
needs?
No, miss my need. I
Like,
mean,
you have a number in your mind which you
no,
think would be fair, or
I don't have a real number. Um, I don't have a real number. I mean, um, but yeah, I think it will be just like to be balancing like what is the cost of living at the moment, and for sure there will be, if there, I know there is some attention and try to even like for nurses that give the chance to rent a council house or thing like that. For example, I apply for the council house because I say that's a good opportunity. Why don't I apply? And I'm still waiting after years for my application to get considered.
yeah, you
Even
get a
like
long time actually.
so it take ages. So for the time probably it's gonna get considered, I will probably be bored and I will probably leave.
Yeah.
And maybe just go outside of London, maybe go to another country where they give me maybe a better opportunity, but like a place where to live, and maybe for a decent quality of living. So yeah, I think it's more about that.
Yeah, just we about to end. What's your professional goals?
Oh, my professional goals at the moment to stay in the profession.
Maybe something else in your mind, or for long term, or like,
mm,
or you simply want to still keep the job you're doing?
uh, not joking. Stay in the profession is the biggest one. I'm up and downs and like I'm thinking I should leave and totally change, and do something else, because I'm tired. Then sometimes I think just like, of course, getting it into a senior position in my role now in intensive care. But there are a lot of things that I like. I mean, I like medicine. That's the biggest problem. I like, yeah, it's a big issue. I like medicine, I like the human body, how things happen in the body, the physiology and stuff like that. So I'm always interested in learning new stuff. So for sure, I would like to in the future to fly with patient, be like a fly nurse.
Yeah, interesting.
Yeah, fly around. I've been flight already. I flight already doing like a
Sound
repatriation.
much more exciting than be
Yeah, a little
stuck on
bit.
the world. Yeah.
I'm always a little bit looking for excitement. You know, I always been always the kind of guy. I had the chance to fly in America, and I was like flying on a helicopter and move patient with an helicopter and like
Oh, did you? Wow.
yeah, yeah. So it was a great. I was just observing, but I was in North Carolina on a flight there, so we were picking up patient from an hospital and bringing the patient to the main
The major
hospital. Like yeah,
centers. Yeah.
like it would be my hospital where I work now. And or repatriate, like or go and getting a patient in the middle of the street or flight, and or getting it over from the ambulance staff, getting the patient on and getting the patient to the trauma center was a pretty cool job, and I the kind of job I like. I mean, I like a little bit of adventure. Yeah, so I will probably still point in that direction, or doing even anything similar, like
Similar. Yeah.
working like in a
Within
war
the same
zone.
industry.
Yeah, work in a war zone, maybe repatriate patient from there,
You
or
wouldn't mind. Yeah.
yeah, yeah. Still wonder. I still that's one of the reason why I studied nursing. I wanted to go to the kind of environment and just like, but then I didn't realize to go to get the kind of environment with the scale that they want. It was a long route,
Yeah.
and I had to learn a lot of stuff. And sometimes I don't feel ready yet, but still a long route. Yeah.
So now just we got last question for anyone getting into nursing, or like studying into nursing or starting to do this job you're doing. what advice would you give for some newbies or somebody who just starting to do
Don't
university?
do nursing. No, I mean, I think nursing is not valorized enough. It's not paid enough. Sometimes I really say people, even in this country, other people to say, "Oh, nursing, nursing. We have Nightingale and stuff like that. We had Nightingale, I mean, and things like that. We are the country of nursing." I think we're not valorized enough. Paramedic has better career than us. Um, the doctors, they have better career than us. So I think it's not a great job on the kind in terms of career development. Is still difficult to grow up in that side. If you
You
really
think
want,
so?
yeah, I still think so. I still, unless you're really happy to move around the
To move around, yeah.
hospital and try, don't do the mistake I did. Uh, and then you can develop quickly. By example, in terms of pay and things like that, it's not so easy to jump into the senior position or things like that. Even in a big city as London. And But if you still like it, I think you still need to have a lot of passion, a lot of dedication, and you need to be able to be empathic. That stressed me so much at university about that, but I still think it is important.
Yeah, I think it's one of the
Yeah,
main skills in
yeah,
order to do this job,
yeah.
isn't it?
But it's draining. It drained me a lot. um, COVID, things kind of experience intensive care. I was finding myself hugging people that don't really know, and they're crying, and I start crying too. And then you go home, and you should live a life as a normal person, but you cannot really live that. So because you are drained,
Yeah, we
and
always
you have
try
to be able to to fill the cap.
to try to
Yeah,
put
try to cut a little bit, but you're not gonna be able to do that. I mean, totally not. But you need to try to distract. Example for me today, yesterday it was a quite heavy day for me. I had this patient and is very sick, and family was thanking me, and I was like filling my cup because they were giving me energy. They were saying to me, "You're doing the best, thank you," and things like that. Even if like my best probably was not gonna make a difference at the end for this patient, but they were filling my cup and giving me energy. But at the same time, I was close to cry with them. So
yeah, it
it's
can be
not,
some
yeah, it's
emotional
not a normal
moment.
job. It's not 9 to 5. It's not working in an office.
Yeah,
You
definitely.
go back home and maybe someone is you go. I don't have family, so my home is empty, and that's not helpful. And you go maybe home and you talk to someone else. Oh, I got the last phone, and this is the most important thing in my life. And don't care. I mean, people die, people suffer. Who cares about a phone?
Yeah.
Who care about these things? And you have to be. So if you want to go in this profession, I think you need to work on yourself a lot. You need to be ready to have a punch in your face and realize that life is something different, and it's not about stupid things. It's about life and death. It's about enjoying life. It's about loving, give love, receive love. And I grew up a lot as a man, as a human being. I think I'm more a man now than I was before nursing. I wanted to be a soldier, fight, die for my country, and I thought that was being a man. And
Actually,
then
give a
then I went into nursing, and I say, "Oops, people here are dying, people here are suffering. This is not a game anymore."
being in contact with suffering, like give a lot of strength. Can we agree on that?
It, it, I think you need to develop your strength, and it takes away your strength also. But yes, it's a punch in the face. That's the only definition I can find. Uh,
All right, Lorenzo. Just want to thank you so much for being here today, and what can I say? Thank you for being here to show everyone what does it mean to be a nurse, and just to have a proper feeling of what does it mean, because you don't usually find those things online or on news. You know what I mean? And thank you for being here, man.
thank you too. For
And
me, it's a great experience. Anyway, I
uh,
will I will chat for hours. I hope that
I mean,
I talk well for all the nurses all over
like
the world.
I'm sure there is a lot of things to talk about. We can have you back
Yeah,
here
we'll
again
probably not
another
have,
time if it's fine for you, and we carry
anytime.
on with the chat then.
Anytime.
All right then. Thank you everyone.
Thank you,
and
everybody.
Thank you again.
Thank